Welcome again to our channel, viewers out there. There are so many people who want to be nurses, but they don't know actually what do they need to be able to train towards this profession in South Africa. Besides, when we get to the hospital, we just see nurses, but there are some categories, you know. So today we've got a special guest. Welcome, Dr. Ruth, to our Top Talks for Better Living.
Yeah, I'm Dr. Beauty Ruth Hlongwane in Limpopo, South Africa, and I'm staying at Giyani. My position at work was head of department in biological and natural sciences. I have just retired. The first thing that I want to say is that before we can need a person to become a student, we do marketing, and our marketing are moving to various schools and teaching grade 10, 11, and 12 about career exhibition, so that when they reach grade 12, they know exactly what is required about them.
Thank you, Doctor, for that. I wasn't aware of exhibitions because during our time, we never had such things. We didn't even know where to start and what is required. To find that sometimes we have studied some other courses like Shinchangana, na history, na Bible, and then you want to be a nurse. So, Doctor, can you tell us about the categories, you know, in short?
Yeah, the first category that we have in nursing auxiliary, as you said, kumbe nursing assistant, and then we say is enrolled nursing auxiliary, the assistant nurse. Then we also have enrolled nurses, staff nurse, those who are having some white epaulets. Oh. And then from there is then that you can go to other categories. But the two are the lower categories in nursing, and they are trained in the nursing schools.
Ah, okay. Oh, I like when you say staff nurse. So in other countries, you know what, a registered nurse is called staff nurse. It was hard for us when we come to the UK, and then people were calling us staff nurse. That we are registered nurse.
With all your qualifications.
Yes. So in short, a staff nurse in South Africa is enrolled nurse. So if I want a job and I want to train to be an auxiliary nurse, what do I need?
In all categories, you must be interested in nursing. However, sometimes you find that people are not interested, but because they are earning money, they do come to nursing. But according to our requirement, we need somebody who is interested in doing nursing.
And that's when we say nursing, it's a call.
Yeah. You must have grade 12 matric. Previously, it was matric, but nowadays they call it national certificate.
Okay, all right.
But you must pass with exemption. Previously, we said it's exemption, but nowadays it's bachelor.
So that will let you train to be an auxiliary nurse. It's an entry to be a nurse or to be a registered nurse.
Yes.
Okay. So are there specific courses that you have to take in this matric, you know, that we can are recommended for these students to do?
Yes, it depends on which level are you going to train. If you want to train as a nurse assistant, you must have grade 12. It doesn't matter about the subject or so. But at least if you have South African ID, you have English in your matric certificate, and you have passed grade 12, you can be taken to train as a nursing auxiliary. And in the progress, you can also proceed to staff nurse in easy language. When you have passed nursing auxiliary, you are allowed to apply again and do enrolled nursing. And from enrolled nursing, you were also allowed to proceed to become a registered nurse by doing bridging course. With that certificate, you pass enrolled nursing auxiliary, you pass enrolled nurses, then you do bridging course and you become a registered nurse.
Oh, so those that don't know what bridging course is correct me if I'm wrong, it's when you study from being a staff nurse to a registered nurse. So it's like from a white epaulets to red ones, right?
Yes, yeah. If you are private, you are training in the private institution, you are not earning like the one who are working under the government.
But the main thing that we want when everyone goes to nursing, want to be a registered nurse, right? Even though we start from auxiliary, at the end of the day, we want to be registered nurses. So what are the courses?
But I'll specify, because
yes,
this nursing auxiliary and enrolled nursing are phasing out. And I think with auxiliary nurses already it's phased out. It's only bridging course that are finishing with phasing out of it. So yeah, regarding when you want to train a nurse, the requirements is that you must have matric certificate. You must have specific subjects, science subjects that are compulsory, such as English. You must have higher grade or symbol D or level 4. You must have biology. Previously it was biology, but now it's known as life science. You must have physical science and also mathematics. These are compulsory. And at school, sometimes you find that they're doing life orientation, but this life orientation doesn't give you anything, a credit. It doesn't give you a credit when you want to train as a nurse. We consider the subject that I have indicated: English higher grade, biology higher grade, or life science higher grade, physics higher grade, and mathematics higher grade.
Wow.
Then you can add whatever subject you want to add. But these are compulsory.
So can we add a vernacular?
In matric, it's a compulsory thing that you must have vernacular. But even if you can have vernacular 90% and you don't English, life science, physics, and maths, that will not help you
much. So if you are a foreigner, you still need the same requirements, I understand.
Yes, especially if you are doing undergraduate. You must have a student permit, and the certificates that you are having, matric certificates or whatever, but they must be assessed under SAQA. It's a qualification board which assess all certificates in South Africa, whether inside South Africa or outside South Africa. You cannot even train as a college without the assessment by SAQA.
So that was a very important point. They should be accredited with the immigration as well, isn't it? So then, where do we apply?
It all depends where you want to apply, because we are having colleges, we are having universities. So in the universities as well as in the college, the requirements are the same. So you can go wherever you want. The difference is that in the university, you don't earn anything. You must pay the fees yourself. But in the college, because we are doing practical as well as learning, you are earning at least something.
Okay. People like us went into nursing because we didn't have money to go to university.
Yeah.
So that was an advantage for us, right? So can you mention some few colleges that are a bit common for
different provinces? There are some colleges, even KwaZulu-Natal, we're having some colleges as well as universities. So a person is allowed mostly to apply in the area where he or she is. And if ever you are a foreigner, then you apply to the South African Nursing Council. The South African Nursing Council is the one that controls nursing. So they'll indicate to you where you can go and train as a foreigner.
Right. It's getting interesting now.
Yeah.
How many years do you train to be an auxiliary, and how many years do you train to be a nurse to be qualified?
Nursing auxiliary, it was just 1 year. And if you do bridging course, you were already an enrolled nurses, and this enrolled nurse was 2 years. So it means you'll be doing for it like 4-year program, because when doing bridging course, you'll undergo 2 years again, and it will make 4 if you started as a nursing auxiliary.
Yeah. So now, when you qualify, so what do you get?
You become a professional nurse. At the moment, we're doing diploma in nursing, general, psychiatry, community, and midwifery. This was a 4-year program, but at the end of the day, you were receiving the epaulets, that is having psychiatry, community, midwifery, and general.
Wow. So that is whether you are doing it
at the university. You don't do diploma. Okay. You go straight to degree.
Okay.
So there is a difference between a 4-year program in the college and that one in the university.
Ah, okay. I hope people are clear now. So I rather go for a diploma. What do you think? What would you say? Because by the time I finish the 4 years, I'll have built my own house, bought a car. And then from the university, I'll come back with some debts.
All is nursing.
Yeah, all is nursing. So now when I finish, I'm a registered nurse now, right? Do they have to write some sort of exam?
Yes, those who are coming from outside countries, they can make them write the examination depending on what you are coming to do in South Africa. But those who are in South Africa, after their completion, they must do community services. And this community services is compulsory. You cannot go and work. They consider you not to be completed before you can finish your ComServe.
Oh, okay. So it's like checking your competency. So now, after we have trained, now we are registered nurses now. So I want to specialize in neonatal care, specialize in something, you know. So how long does it take to do all those specialty areas? Or it's a year?
It all depends on the type of the course that you want to do. But majority is about 2 years, because they are doing also a research. And we're having so many like primary health care nursing, like trauma, orthopedic, intensive care unit, advanced midwifery, geriatric, neonatal nursing. And if you want to do something about the eye, in fact, I can say each and every part of your body, there is a special course that is related to that. If it's bone, you'll have that diploma. If it's eye, you'll have that diploma, anything.
So, doctor, tell us, like, from being a professional nurse or with that degree, what can you study to, step by step up to the level? Just in brief, it's so interesting because most of the time we take nursing profession as just ending up there in the unit, cleaning the bedpans and looking after the patient.
Yeah. You do a degree, you are having a degree, isn't it? You trained at the college.
Yes.
From the college, you are allowed to apply to the university with that diploma. They can take you to continue and do degree. So after degree, you can choose to continue with your degree related to community nursing or education, or admin education, or ethics or education. You just choose some courses which you want to choose in order to do your degree after you have completed the diploma. And from the degree, you can continue to do honors depending on the university. Some universities, from the bachelor degrees, you move to master's degree. But some you must do honors degree, then master's degree. From the master's degree, in master's degree mostly is about introduction to research, but you must do a full research and write a report, just like in doctorate. But after master's degree, you continue to doctorate. There you must develop something. It's not just passing the examination or writing a book only, but you must be able to design a program or some guidelines, whatever you'll choose to do to continue with your doctorate. And then after that, you can also become a professor if you are not lazy, because becoming a professor, you are no longer actually learning, but you must write articles, you must write books until you are promoted to be a professor. In other words, you cannot say, I'm learning now, I want to be a professor. No, the highest qualification is doctorate. And then after doctorate is then that you can write some books, write some articles, depending on how many with that university, and then until they consider you to be a professor. And still you start with associate professor before you can become a professor.
Ooh. What about a consultant? Do we have consultants on nursing?
Yes, we do have consultants. It depends on whether you want to be a consultant or not. Because even if you are just a mere registered nurse, you can open your own clinic to consult patients.
Oh.
You can open your own office where people can come and consult. Most of the people who are working at the university, when they retire, they open their offices and become consultants.
That's interesting. So nursing, that is nursing for you in South Africa, guys. Have we left anything?
What I can say is that that 4-year program I was talking about, it is being phased out gradually. We are now left with those who are doing 4th level. But from 2020, we are having another R171. It's a diploma in nursing. It's no longer a 4-year program. It will be a 3-year program.
For us to improve, there should be change, you know. Nursing in South Africa is not relaxed as well, just competing with the revolution of the country.
Yes.
So to conclude, Doctor, words of encouragement to people or whatever you want to say to our viewers.
Yeah, what I can say is that you understand that when you become a nurse, you are dealing with a person. So you must have at least love for people. And I can encourage people even to have faith in our Creator, because it needs hard work. You must work hard in order to help people. You must have sympathy and empathy while treating our patients. So I can encourage people that it's not that difficult, but I don't want to lie. You heard me saying we want science subject, because you must know a person from inside out. Where I am now, I can tell you that Elta is so and so and so and so where she is by looking at her at the moment. I can tell you whether she's stressed or she's what. So in other words, in other words, you must be able to know and understand a person if you want to enjoy nursing.
Yes, yes, yes. Oh, thank you so much, Doctor.
Oh, the epilepsy
Yes.
that we are having, this is the example. You can see every bar here, it indicates what you have. So midwifery, community, nursing education, and nursing administration.
That is why when we are qualified now, you walk with your shoulders up.
With your shoulders like this.
As Doctor has said, that things are changing. So it is wise for you to do your little research as well. Yeah? You can call South African Nursing Council. They will give you the proper information again, just to add on what we have told you now. You know, the number is +27 12 420 1000, or when you are in South Africa, you can just dial 012 420 1000, or you can email customer service at sanc.co.za. On the comment down there, tell us what you want to know about nursing. That is a very good reminder, Doctor. Thank you so much. And you can as well add some more information. Let's reach out. So thank you so much, Doctor, for the info. Is there anything else?
No, I can say, well, I enjoyed meeting you guys. Enjoy the day. God bless you all. Bye.
Have a blessed Sunday afternoon. Bye for now.